Hello, it's Mayor Bob Odekirk. I just want to say we're going to continue with the COVID updates. We were doing this pretty much weekly for a while, and then with some of the other things that happen in our city and in our country, we've gotten away from that. But we're going to start doing this on a bi-weekly basis. I want to thank Fire Deputy Chief Jeff Carey for compiling these numbers, and we're going to pass the information along to the people of Joliet. I just want to reinforce that while the numbers are better in our city, the disease is still here. The virus has not gone away, and we're going to urge people to continue to practice social distancing, wearing masks in public if they feel it's appropriate. I think at this point, enough people have they understand what we're up against and what they need to do, and I think the fact that we've had compliance with our public shows why the numbers are down. They should continue that way. One other thing I want to add, which is good news. Initially, Governor Pritzker lumped Will County and Joliet in with Cook County with the city of Chicago. Myself and a lot of other local mayors protested that. We did not believe that our situation should be tied to what happens in Chicago or in Cook County. I'm happy to say the governor has reconsidered. We're in a different zone now on the governor's map. So, of course, we're still going to follow the mandates from the CDC and from the governor's office, but I'm happy to say that we're going to be judged for what's happening here in our community, not what's happening 45 miles to the north. So that's good news. And again, thank you, Jeff Carey and our fire department. Thanks to all our city employees and the first responders that have worked through the COVID crisis. And I wish everyone a happy and healthy and safe summer. Thank you.
Hello, my name is Jeff Carey. I am the Deputy Chief of the Joliet Fire Department. We're going to be bringing you bi-weekly updates on the current COVID-19 pandemic as it relates to the City of Joliet, starting Friday, July 24th, 2020. We see the numbers on the news from all over the country that are steadily rising, and at this time we have not seen that yet here in the City of Joliet. We get all of our COVID-related numbers from the Will County Health Department and the Illinois Department of Public Health, and we follow the guidance of the CDC and the Illinois Department of Public Health. You can visit their websites for additional resources on this information. As the COVID numbers are rapidly rising around the country, we have not seen a large increase in Joliet at this time. We saw our numbers peak at the end of May and then saw a steady decline through June. In July, we have leveled off near our lows. I use a 2-week average to show the numbers because most patients fully recover within 2 weeks of getting COVID. This gives us a better idea of how many active cases we currently have. Joliet's 2-week rolling average COVID number cases was 461 at the end of May. We bottomed at 102 for the week ending June 26th. Our 2-week average has risen slightly since the bottom, but has stabilized in the 130 to 140 range over the past 4 weeks. This is still the lowest numbers we have seen since we had our first case at the end of March, even as the state is testing a record number of people every day. A big part of the decisions being made by the state depend on the ability for the healthcare system to keep up. The COVID numbers from Amita St. Joe's and Silver Cross remain near their all-time lows since this started. St. Joe's currently has 10 COVID positive patients with 13 persons under investigation. Silver Cross has 7 COVID positive patients with 11 persons under investigation. A person under investigation basically means they have COVID-like symptoms, have had a COVID test, and are awaiting results, so they must remain in isolation until those results come back. This is a total of 41 COVID-related patients for both hospitals. These total numbers were over 100 for most of April and May, with a high of 146 on April 10th. The hospital censuses are up from your everyday illness and injury as people are getting back out, but the COVID activity remains stable and near the lows. The nursing homes in Joliet have also stabilized, with only a couple of new cases coming in the past month. Everyone has been doing a great job following the CDC guidelines, as you can see with our numbers. We need to keep practicing these guidelines to help our hospitals stay at a manageable level, and this will also help us remain open and safe. Questions that we get asked a lot are about signs and symptoms. If you go to the CDC website, you will find a wide variety of symptoms that seemingly covers everything. A new analysis of records done by the CDC has found that most patients, 96%, seem to share at least one of 3 symptoms: fever, cough, or difficulty in breathing. 45% of patients experienced all 3. Cough was the most common at 84%, and fever was second at 80%. Fever was not always an initial symptom, but came on later in patients. Patients who had difficulty in breathing were more commonly associated with people who were hospitalized. One of the most common symptoms that we see with young, healthy individuals is the loss of taste and smell. Another question we get asked a lot is when you need to get immediate medical attention. If you test positive, you will most likely be sent home to isolate while you recover. The majority of COVID patients do not require inpatient treatment. If you test positive and are sent home to recover, it is important that you seek medical treatment immediately if you start having any of the following symptoms. These include difficulty in breathing, chest pain, new confusion, inability to stay awake, bluish lips or face. In almost all the deaths that we have transported here in the City of Joliet, the patient had trouble breathing 2 to 3 days prior and did not get medical treatment. This is too long to wait. Do not wait if you start to experience any of these symptoms, as these indicate a true emergency. This is probably the pneumonia coming on and you're starting to get fluid in your lungs and you need to get treated immediately. There are a lot of feelings about having to wear a mask. Illinois started mandating the use of masks starting May 1st. A few weeks after this is when we started to see our total numbers start to drop, even as the amount of testing has increased and more things have opened up. States that open while not requiring masks are seeing the largest spikes and all starting to shut things back down again. If everyone keeps wearing a mask, washes their hands, and practices CDC guidelines like social distancing, we can hopefully keep these numbers low and safely remain open and healthy. We'll continue to monitor the numbers and let you know of any changes. We will remain prepared if we do see any increase into the fall. We want to let you know that if you have any questions, you can email us at askafirefighter@joliet.gov. Thank you for being with us today, and we will see you again in 2 weeks. Thank you.